Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
Jean Marie will not be with us today. Collectively, we are the hosts of PodcastDX. On today's show, we are speaking with Dr. Ebony Cornish. Dr. Cornish is a highly regarded physician who provides integrative medicine services to a diverse global patient community. Currently serving as the Functional Medicine Director of the Amen Clinic East Coast Division, she specializes in autoimmune diseases, Lyme diseases, environmental toxicity, gut imbalances, neurology, and other chronic conditions. Employing a holistic approach, Dr. Cornish identifies the root causes of health issues within the body's biological systems, offering comprehensive treatment to adults and children. Her treatment philosophy is integrative and evidence-based. Dr. Cornish's educational journey includes earning honors at Brown University for her undergraduate studies and obtaining her medical degree, her MD, from Brown University Medical School. She further refined her skills through a family medicine residency at Georgetown University. As a Howard Hughes Medical Fellow, Dr. Cornish conducted translational research at the National Human Genome Research Institute at the National Institutes of Health, working under Francis Collins, MD, PhD. She currently serves as the treasurer of the board for the International Lyme and Associated Diseases Society and a fellow of the Institute of Functional Medicine. Acknowledged as an authority in her field, Dr. Cornish was honored as Northern Virginia's top doctor for family practice in 2021 and 2022. She has also been recognized by Continental Who's Who as an exceptional woman in healthcare, highlighting her professional excellence at Amen Clinics. Beside her clinical practice, Dr. Cornish is passionate about education, regularly conducting webinars to inspire medical professionals to understand functional medicine better. Dr. Cornish is joining us today to discuss potential neurological conditions and complications that result from chronic infectious disease. Welcome to the show, Dr. Cornish.
Oh, thank you so much for that kind introduction. I'm excited to be here.
Well, good morning. That was quite incredible. You have a storied career. Welcome to the show. Let's just jump right into it. What led you to go into the medical profession?
So it's interesting. So I was trained, as stated, in family practice, and I had no idea that chronic Lyme was even a condition or functional medicine. So one of my first jobs out of residency was actually a Craigslist ad. I was shopping for a TV, ran across a job, and the title said for doctors that think outside the box. And I thought, oh, why not? Let's try that. And lo and behold, that job was at a Lyme practice, and I was exposed to chronic Lyme disease management and treatment, as well as functional medicine. And it was like after that, I couldn't go back to traditional medicine.
Understood, yeah.
We are actually going to be taping, it's kind of funny, we're going to be taping an episode later today, just amongst ourselves, comparing functional medicine, complementary medicine, and Western medicine. So all of these terms are sometimes, and all the specialties within the medicines, and sometimes all of these terms can be lost, but you found the one that really spoke to you and you stayed with it, and that's what it takes to become a good person in whatever field you're in. You have to believe in it, you have to own it, and you're doing well. And Dr. Cornish, what is chronic infectious disease?
So the way I look at it is if you're suffering from a disease complex that has what I call a waxing, waning course, or maybe something that you were treated for and it didn't resolve. So chronic illness, it doesn't matter what time span it is. Traditionally in our textbooks, we learned that 3 months, after 3 months, your immune system became chronic. But we are learning that's not necessarily the case. So what I tell patients, just like who might have chronic Lyme, chronic COVID, chronic Epstein-Barr, that listen, if you're getting treated and your symptoms haven't resolved over a longer period of time, then that is considered a chronic condition. And at the same time, if you've been treated for something and then those same symptoms flare up later, like when your body is under stress, when your immune system changes, or when your environment changes, or when you get other exposures, that reactivation of that initial infection is also a chronic condition.
Okay, good explanation. And how can chronic infectious disease lead to neurological complications?
So with tick-borne diseases, let's focus on that
Sure.
first, because we're going to talk a lot. We're going to get in all the juicy details. But we know that with tick-borne diseases like Lyme disease and co-infections, if you catch it early, you have a more likely to have a positive outcome. However, if you wait, too long, and in some cases, too long might be for a month, depending on their immune system, and it can be as long as 10 months. I even see patients who have had Lyme transmitted from mother to fetus, and that's called gestational Lyme. So the longer you have this infection, because it can have a negative impact on your immune cells, you can start getting neurological manifestations of disease in late stage Lyme disease. And that's typically the patients that I treat because more likely than not, they've been to 3 or 4 doctors before they come to my doorstep. And they're having those neurological changes. They're having that cognitive dysfunction. They're having those, nerve, like what we call neuropathy, numbness and tingling. They're applying sometimes for disability due to their inability to, stay up and that chronic fatigue that you just can't shake off, among other conditions. So, you just have to think, and that's why I always tell patients, if you think that tick-borne diseases or any chronic infection is contributing to your clinical presentation, you need to get treated, and you need to get treated early before it converts over to a chronic complex illness.
Okay.
So to follow up with that, what are some of these symptoms that you find of a neurological complication? I think you mentioned like the fatigue and all that. What are some other symptoms?
So one of the things that we do at the Amen Clinic is we focus on brain imaging and brain inflammation, which is also called neuroinflammation. So at times we'll see abnormal brain SPECT scan images of patients who have chronic illness, which looks like what we call inflammatory. So we have an algorithm where we can outline if a brain is inflammatory or not. And we also have an algorithm which gives us a clinical clue that it may be a toxin or an infection that's contributing to that patient's symptom. And that's why I like looking at the brain, because historically, I would say, oh yeah, it's tick-borne, it's neurological Lyme. But having the ability in some cases to have that brain imaging is very helpful. And at the same time, I see patients, as I stated earlier, who have severe debilitating neurological symptoms as it relates to cognitive dysfunction. But because Lyme is the great imitator, that means it imitates other illnesses. Some patients present to my office, and this is very often, with symptoms in keeping with multiple sclerosis or Parkinsonian, neurological features. And they may have failed treatment. And when we do testing for tick-borne diseases, we find out that could be a root cause. And then at the same time, you had to think about mood, because I see patients, even though I'm a family practice doctor, who have severe anxiety due to Lyme disease, severe depression due to Lyme, and even psychoses, which is also another sign of chronic neurological infections. So it's across the gamut what you see as it affects the brain, from mood to anatomy to cognition, but you really won't know until you look.
What type of brain imaging do you do? What do you count on?
So the SPECT scan is something that I commonly use. Now, I don't use that for all of my patients, but I do use that for those who desire it. So it's a 3D image of your brain. It's beautiful because it tells you what areas of your brain are working well, what areas of your brain are not working well, and it looks at blood flow as well as activity. And I find that it's helpful because when I have a patient who has severe neurological symptoms and I get stuck, right? Or if a psychiatrist, like I work directly with Dr. Amen from our clinics, he might send me a case where there is an abnormal brain scan that doesn't look quite keeping in like quite similar to our algorithm based on their kind of psychiatric diagnoses, so we know something is going on. And that image is wonderful because it tells me, oh, well, this patient, they're anxious because this part of the brain is overactive, like the limbic system, or they're having brain fog, but it might be frontal temporal dementia, or it might also be compounded by a traumatic brain injury, or a focus issue. So it's one of those things that really helps me when I get stuck and I want to know, is this all just infection or did I miss something? And a lot of times, I would say half of the time, it's because there's something they didn't tell me. They didn't tell me about that concussion. They didn't tell me about, the misdiagnoses of dementia. They didn't tell me of a lot of things. And it's like, oh, yeah, that was the missing piece.
Gotcha.
Okay, all right. And how? Okay, so we already did the testing, right? Well, no, not necessarily. We just talked about the scan. Are there any other testings that you do for neurological complications? For instance, when I personally was misdiagnosed with early onset Alzheimer's, and only recently in the last 5 years did we find out that it's complex PTSD amnesia. But in order to get that diagnosis, I had to undergo a 3 or 4 hour neuropsychological exam. Do you have to do testing like that with your patients?
I don't, because I'm not a psychiatrist, test my private patients. So at Amen Clinic, I have my private Lyme, autism, functional medicine practice where I look at the root cause. And I also get several referrals from the psychiatrists around the country who work at Amen Clinic who have neuropsychiatric manifestations of disease. So personally, I tend to use one of the MSID kind of questionnaires, like a Horowitz or one by Joe Burrascano, which is a clinical presentation questionnaire where people take a survey and they can rate their symptoms in severity. And the entire questionnaire, those symptoms are in keeping with tick-borne diseases specifically. And so from there, and just being a clinician, right? Because that's the biggest part of this, is being able to listen to your patients and understand their story, and using the questionnaire as a diagnostic supportive tool. I do find that I can have a differential diagnosis before the patient even walks through the door
Okay.
based on what they've told me.
All
So
right.
that's really helpful for the neurological changes as well.
Sure, sure. And what is the typical course of treatment for the neurological complications?
And you know what? I'm one of those doctors who does not have a standard paradigm. Now, earlier in my career, because I've been treating Lyme for about 11 years now, and in Lyme years, it's like dog years, right? Because we evolved so much, even over a 1 year span. But initially, it was just primarily only antibiotics. So if you had a neurological Lyme case, you would do an IV course of antibiotics, maybe multiple different antibiotics IV, or oral antibiotics that cross into the blood-brain barrier. So those are things like IV Rocephin, IV, which is also called ceftriaxone, IV Zithromax, oral antibiotics like Ceftonir or Rifampin, Zithromax, Ceftin, just to name a few, among numerous others. So that's what I would focus primarily on. But as I've been trained and I've done more research, because all of this is on a job training and had more patients, I have noticed that in some cases, and like I said, this is individualized in my practice, they may require both herbals as well as antibiotics. And some patients may have been, treated for years with antibiotics and have disrupted gut microbiome or, severe pill fatigue or even multiple chemical sensitivities. And then I have to find strategies to utilize herbals that cross the blood-brain barrier, other alternative treatment like a methylene blue or allicin, just to name a few, which is garlic or oregano oil or different supplement companies, so that I get that same coverage for the neurological changes, because that's what you see a lot. Once it's neurologic, it's been there for quite some time, and patients have tried a lot of things. And so I also introduce therapeutic interventions in some cases, like hyperbaric oxygen therapy, because we know that that also can kill. In the research, Borrelia burgdorferi, but at the same time, it can help with blood flow to the brain, for regeneration of new blood vessels, and for detoxing. So every patient, when you walk in my door, Dr. Cornish is going to treat you based on you, not based on a protocol.
Good.
Okay.
Good.
Are you finding the same results with long COVID patients as you are with Lyme? So in other words, is your strategy basically the same for both groups?
So let me tell you about how I think of long COVID. And one of my patients, she was so cute. She told me I should patent this this analogy. So I think of COVID and long COVID. Everyone's familiar with the music video Michael Jackson's Thriller. And we remember how all these other zombies kind of came out of the graveyard once he was there and dancing, right? That's kind of what long COVID does. It's not necessarily how bad that spike protein is, which can be devastating and very serious with long COVID. But at the same time, it can reactivate other illnesses that were in your body, right? And make them flare up. So someone might have had Lyme disease 20 years ago, may be in remission, and then they're coming back to my doorstep after having a COVID infection, or having, a vaccination, and they may flare up because COVID is very much inflammatory.
Okay.
And we see a lot of cognitive changes with COVID and neuropsychiatric changes with COVID. So I kind of think almost of COVID like the great imitator, but I think it's the great reactivator, if that's a term, because it flares up
That's a great way to explain it.
That is good. Yeah.
To cold to Lyme, you name it. If it was in your body and your immune system was strong enough to deal with it, it's coming back. and you're suffering from those symptoms. So as a result of that, it actually overlaps the symptoms of COVID and long COVID with numerous other chronic infections.
That's probably the best explanation I've heard of it.
Yeah.
You know, I mean, well, COVID's been around since what, 2020?
years, yeah.
And then you start hearing about the long COVID and all this stuff. But that was probably the best explanation. It can reactivate something that's dormant in the system. That was amazing.
Thank God.
Yeah,
it doesn't-
COVID is very inflammatory, man. I see it every day. I told my husband, I hate COVID, you know.
Yeah, right.
Just because so many of my patients that are doing so well come running back completely almost back to day one in a relapse, or my patients where we had tried so many strategies and I saw them almost at the finish line and oops, COVID, the second, third, fourth bout of COVID, and now they're relapsing again. So
Yeah.
it's an awful, awful thing. And it's because of it's compromising your immune system and all those other things, terrible things coming back to the surface.
So I saw something here, and this sounds really interesting. I want you to go more in depth about this. The Neuroinflammatory Intensive program. You helped develop that?
Oh my God. This is like, I told you I had triplets.
Yeah.
This is my quadruplet. All right. It's like a passion of mine because I had patients who would go all around the world and country because, as I said, I treat them like chronic Lyme. And they would have invested so much money and so many resources. And then they would return, to their doctor temporarily better, but completely relapsing after being through a program. So what I had envisioned in my kind of dream has always been to have a program where patients can get that intensive love that they need so they can travel to see me, because I really think that's so important. And that because I treat patients from all around the globe and they travel, we get their brain scan first. So we have an image of their brain and we know kind of how to structure our plan according to that image. So may that be neuroinflammation, may that be brain, areas like that's called atrophy, where blood's not going there at all. May that be traumatic brain and Lyme, or like I say, all the things. So because we have those certain patterns, before they walk into their first doctor's visit, we know what their brain looks like. And that's kind of one thing that's missing from a lot of these residential Lyme patient programs, is that they don't have that image. So after that, they then meet with the nutritionist. And the concept came up because I had a patient from South Africa who had kind of the equivalent of this process occur for 2 weeks, but that nutritionist and brain scan blew her mind. And then they meet with me twice a week. I review their brain scan results. I'd let them know what the treatment interventions will be, how severely their brain has been inflamed, what areas of the brain have been inflamed, because there are certain areas that you might have mast cell activation, meaning someone might be very sensitive to medications. So I might have patients where I can implement other protocols. So I might have to implement an antimicrobial Lyme, tick-borne disease, and co-infections protocol, as well as one for supporting traumatic brain injury, or one to help with focus, or another one that might be things to calm the brain down so you're not in this constant anxious fight or flight, which I see all the time. So I get an analysis of what's going on, and then I can also structure treatment based on what part of the brain is inflamed. Is it the temporal lobe, which is for cognition? Is it the frontal lobe, which is executive function? Is it the cerebellum, which is the boss? If it's the basal ganglia and limbic system, which keeps you anxious and in that fight or flight, among other, symptoms that they may cause. So then I can say, okay, look, this is how we're going to start. I see you on that Tuesday after you arrive. Then I see you again that Thursday. And at the same time, I've also determined what type of infusions they need. So they see me twice a week for 2 weeks, very close follow up, and then they get infusions. So we have the ability to do everything from IV antibiotics for someone who might have that MS, Parkinsonians, or as we were describing earlier, that severe chronic neurological Lyme
Right.
presentation, and especially those whose brain scans have severely been impacted by inflammation. They may require us to have that get in, get out method while we can monitor them very closely, right? I might do IV methylene blue, which has been shown to help with neurological Lyme and co-infections like babesiosis. I'll do things like B vitamin, Myers cocktails, glutathione, something called NAD that gives you energy. So those protocols are all structured based on lab results, because before they walked through the door, they've had Lyme testing through IGeneX labs, they've had mold testing through Vibrant Labs, and they've had neurological autoimmune inflammatory markers from Vibrant Labs. So we have all this data as well as their hormones and like thyroid, sex hormones, liver, kidney function. So we're going in there really prepared and armed and ready to get them in the right track. And one of my pediatric patients, and this one I said, oh my God, I have to do this. She traveled from London and she was terrible with her diet, but her parents said, look, you can only eat what comes into this, hotel and on this stove. And if not, well, you're not going to eat. So it's just one of those things that can encourage compliance. And because we have that testing, and even if they have things like environmental illnesses, we can say, look, get your home, reevaluate it so you don't lose these therapeutic gains. And at the same time, if there are hormone issues that complicate tick-borne diseases, we can treat that as well. Because when you're treating these complex neurological conditions, I'll tell you, there is usually more than one thing going on.
Right.
It's your body is more susceptible to chronic illness. You might have a hormone problem or a mold problem or a detox genetic problem or a metal problem, just to name a few. So that's why we incorporate all those different strategies, so that at the end of that 2-week cycle and those 4 IVs and that nutritional change and that brain support and all that testing, even if they need hormone, thyroid, sex hormones, immune system support, they at least have been 100% compliant, and they can then go home to, their home physician, or if they follow with us afterwards, because I have a nurse practitioner who's
Mhm.
also working with me as well. So we're so excited. And it's also another way for our clinic, which is known as a neuropsychiatric clinic, because that's what they do, to also kind of be the leaders in just brain health in general. So when I tell you I'm excited, it's like you would think my birthday was coming up times 2, and Christmas and every other holiday, because I really think just having the experience with those patients who have traveled and been able to do intensive treatments, that has been extremely helpful long term.
Yeah, I can tell by your response that this program is your fourth child.
Yeah, I'm so passionate about it, and it's the fact that Amen Clinic was supportive,
Yeah.
especially Dr. Amen, of this, because they understand that there's such a huge need for patients who have these chronic illnesses, no matter what it is. Because I have people who are traveling that have been diagnosed with lupus or autoimmune disease, right? Or I might have a patient who has Crohn's or gut imbalances, or autism, or pediatric autoimmune neuropsychiatric diseases associated with strep, or just that anxiety that they don't understand, or depression. So it covers a wide range of conditions, but we're really focusing on those patients who've been kicked out the doctor's office, misdiagnosed for years, taking meds that don't work, told their tests are normal, and they want to get down to the nitty gritty and that
Exactly.
root cause, and then boom, hit them with the treatment in a more aggressive manner, while they're in a comfortable and close management of a doctor.
Thank you.
Yeah, no, that's phenomenal. Kind of wanted to follow up with exercise, I guess. So when you have patients with chronic infectious diseases, I'm sure the last thing they feel like doing is being active or exercising. But I mean, how do you get that across to them about the importance of it? How do you present to them?
So, one thing is it depends on that patient's baseline status
Hmm.
once they begin the treatment process, because there's an area in the cell, a part of the cell called the mitochondria. And we always hear about mitochondria support. But when you're chronically ill, your mitochondria and your cells, they go into what we call a cell danger response. And it's kind of like the mitochondria are like, look, I'm not going to heal. Go out and fight whatever it is that's attacking these cells, because if I'm nice and healthy, maybe those threats will use this mitochondria and this energy for their benefit. So I'm like over this process of healing. And that's when you get the mitochondria dysfunction that you see so often. Because you know what? And in general, our mitochondria, even in acute illness, because what happens when you get tired or when you get an infection, you get tired. That's
Hmm.
like the first sign. That's a protective mechanism that the mitochondria does for your benefit. So, patients who have been sedentary or really don't have a lot of that strength, I tell them, look, maybe try a minute, maybe get like a stepper at home, maybe use an infrared sauna, which is also a form of cardiovascular activity. Because if I push them too hard, they're going to have what we call post exertional fatigue, meaning that patient who's been debilitated and on the bed rest or just, out of shape. I push them, go exercise 30 minutes, and then they need like a week or two to recover. So that's what post exertional fatigue is. So I have to find a balance between what the patient's body is telling me and what their compliance level will be, and also what they can tolerate. But if they're a patient who's on that road to healing, and I feel like their mitochondria is functioning and they won't have that risk of like that relapse fatigue where you're like passed out, like so many patients tell me, then we try gradually.
Right.
I'm realistic. Hey, you haven't exercised in about a year. Let's do 5 minutes. And I've learned my lessons, because I've had one patient who like went from disability to getting great, feeling great, and then ran a 5K and then came back just feeling terrible. And I'm like, okay, you have to have moderation.
You can't
So
go 0
you
to 100.
slowly, right. He was just so excited, but then he was wiped out and didn't understand why his fatigue came back.
Yeah.
So it's slow. You got to take baby steps. But that exercise is helpful not only for brain health, but just your overall body. But take it slow and at your own rate and your own pace.
I wish I could have. I wish I knew that about 30 years ago when I was at OCS. I could have said, but TAC officer, I can't do anymore. My mitochondria are telling me you got to take a break. Yeah.
Right. I'm in the cell danger response. Don't you know?
Yeah,
Haven't you read the paper by Navio? And they would have looked at you and said, get up and run. Right. But, understanding that that's a protective mechanism was game changing for me.
Oh, you
and
probably
so that
weren't
just
even
showed
born
me I
by
have
then.
to kind of remove all the problems
Right.
to the best of my ability, right?
Sure.
That's causing that mitochondria without forcing the issue. So many doctors force it, like, yeah, you need it right away. And I'm
Yeah.
like, wait, let's
You got to
treat
be
what's
realistic.
causing it,
Right.
and then give the support.
Got it. And how about nutrition? What part does nutrition play in all of this?
Now that's number one, right? Because what I tell patients, and this is true, only thing you can control when you come in my office and I'm treating complex chronic illnesses is what you eat and where you live. That's it. Everything else is treatment. I'm treating you. You can control what you eat and where you live in life in general, and so you gotta eat the foods that are healthy for your brain. So we go through trials. A lot of times I'll keep my patients on like a Whole30 trial or a paleo trial, or, if there's someone who comes in the door and they're like eating terribly, we work on eliminating things, because the way I frame it, and this is true, you go to a doctor, you finally have the strength to get yourself taken care of. You've been compromised for years. Why sabotage your efforts by not trying to heal your gut? Because that's straight up sabotage. And a lot of Lyme specialists don't take insurance. It's very few of us that are in that network. So why waste the resources? Because the more you eat that's toxic, the more medications and supplements you're going to need to take. And because the gut and the brain are connected by the longest nerve in your body, if you abuse your gut, you're abusing your brain. So that's why I say you have to eat to make your brain healthy. And it just makes sense. So a lot of times I have to start some patients who aren't that committed, and they just come to the office, treat my Lyme, treat my autism, get me out of here, I'm done, get me ready, I'm out, give me the meds. I'm like, how many meds do you want? Right? And how much money do you want to spend on meds and supplements? Well, if you don't want to do a lot of that, let's work on healing the gut so you don't have leaky gut and you're maximally absorbing the nutrients and supplements and medications that you're taking. And not only that, the inflammation in your brain is down. And even at other times, I have to have a barter system with kids, especially. I'm like, okay, if you take away, gluten, I'll take away 2 supplements.
Yeah.
But if you don't, then I'm going to have to add 2 to compensate for the damage that's happening with your brain by those unhealthy choices. So you got to try your best. I tell patients to try their best. I'm not one of those, adamant, you must, or you leave my practice, but I give them examples of people who do well. And when they ask me how long it's going to take to suffer from this neurological illness, I ask them how long do they want it to take. And we start really with getting that nutritional strategy, because it just makes sense. You don't want sabotage. I know I don't.
No, but you're working against all of the marketing gurus that are pushing all of these ultra-processed foods on every commercial that's hitting the airwaves. So, it's just little old you compared to big old them. You got a heck of a job ahead of you.
It's absolutely right. But the thing is, when patients make those changes and they make those decisions, even if they make one change at a time, because ideally you want to remove the gluten, because we know the gluten and processed wheat now is much different and more toxic than it was even 30 years ago. And of course, sugar, because sugar feeds yeast, which is also called candida. And I like to say yeast is a beast because it becomes very resistant. It damages your gut. It can damage the central nervous system and cause all the other symptoms that vector-borne diseases can cause, all because we're eating sugar. And then you're also worried about prediabetes and the like. And then you want to, in some cases, you may limit dairy. And then in other cases, like if they have alpha-gal or meat allergy, you might limit that as well. But patients crack me up when they say, Dr. Cornish, you made me allergic to gluten. I was like, no, your body didn't need it. And so when you eat it now, it's going to tell you that and reject it. And to be honest, I said that to myself when I became gluten-free and removed the sugar, because you go through this like detox period where all those toxins are released so rapidly that you feel terrible at first. And then you start coming around when your liver's like, oh, wow, you just got rid of a lot of toxins and I can't keep up. But then over time it does, as the longer you just have that lifestyle. But in the beginning it's hard, and you just have to try your best.
Wouldn't it be nice if you had that power that the patient was telling you about?
Yeah, magic.
Can you tell us more about your role at the Amen Clinic?
So I am what you call the functional medicine director of our Eastern Division. So what we have over 11 clinics around the country,
Okay.
and I'm in the Washington, D.C. clinic. We also have clinics in Miami, in Atlanta. We have one in New York, Chicago. We have two in Texas, Arizona, three in California, and one in Seattle, and we're still growing. So those doctors, primarily at the clinic, and we'll use Dr. Amen for an example, his paradigm is based on SPECT scan imaging and understanding the root cause of neuropsychiatric imaging. And the first patient about 11 years ago that I met from Amen Clinic, the previous medical director in our area, in our Virginia area, his daughter had severe psychiatric symptoms. I mean, failed all kind of meds. And then we did our testing for Lyme, and sure enough, she had Lyme disease. So that kind of started this process where we start looking at that root cause
Mm-hmm.
after getting that brain scan for their neuropsychiatric conditions. So what I also do, I have multiple medical licenses. So I kind of get consults a lot from Dr. Aim and his patients or other doctors when they're like, look, we need detective work. So they call me Detective Cornish. So I kind of go in there and do my thing and try to find out the root cause and, use the imaging to help me with that. And sometimes I don't have the imaging at my disposal because the psychiatrist will say, you need to see Dr. Cornish first. And I also merged my private practice with Amen Clinic. So I also see patients who are not Amen Clinic patients
Mm-hmm.
who just want a 1 hour workup for tick-borne diseases, for parasites, for Morgellons, autism, gut, mold, you name it. It's like, my friend told me I'm the doctor of all the things. And I'm like, yeah, I kind of like that because I think the researcher in me and the secret kid in me is always asking the question, why? Why is this happening? Why is this? So understanding the root cause, especially as an MD, is very important because I use a lot of times a combination of Eastern and Western medicine and just clinical presentation. So I've been blessed to have that opportunity to, be that director. It helped me with developing the program, and it also allows for me to have a lot of collaborative efforts with colleagues. And it's magical what can happen, when you treat the root cause. They don't need the psych meds, right? And they might not need all these meds for multiple sclerosis. It's all about uncovering the real problem. And that's what I love to do.
Excellent.
Dr. Cornish, what can a new patient do to facilitate their care?
So, like I said, I see everyone, I am a detective. So, and then the majority of my patients have been either referred to me by other colleagues when they're clinically stuck. They can also call the International Lyme and Associated Diseases Society and find doctors in that area. They might hear from word of mouth, even from YouTube or any kind of podcast, and they come with those questions. I would say probably five in the last 11 years, the patients have just come in, just became sick yesterday. That's very. I don't like acute illness. Detective Cornish is going to look at those no matter what you're struggling with. That is interesting and it can't be explained or resistant to treatment. And that's a whole list. Like the things you said in my bio, that's just a few. It's just, whenever you're struggling and you don't know why. And I put that researcher detective hat on board and work as hard as I can to ask the right questions. And that's what I tell patients every day. No one can promise everything. And if you go in a doctor's office and they promise you, oh, I'm going to treat anything you have and you're going to get cured because I know it all. No, the body and the knowledge and the research is ever evolving.
Mm-hmm.
I pride myself
Right.
on staying on top of conferences and different, having to surround myself with really smart colleagues that are collaborative and share information, and just, having that experience to learn and to expand my paradigm. But I never say, oh, I'm going to cure everything. I just say, I'm going to try my best
Mm-hmm.
to figure this out, right? I'm going to try to ask the right questions to get you some help. And I'm not going to give up until I at least figure it out. And then once I figure it out, I'm going to try my best to get you better. But you can't cure everything and you won't know everything. And all you can do is just try your best, if you can, at figuring out what's wrong with that person.
Right.
And what advice do you give for current or prospective medical students?
I say be open, right? Because in medical school, I didn't learn any of this, right? I think Brown should have gave me my loan money back because I didn't learn any of this. It was all on the job training. Now, I did learn some of the basic science,
Mhm.
right? But in residency, we don't perform basic science, medicine. We perform what we consider clinical medicine. So I also tell patients, kids and students, just remember that you can take what you learn from the books to the
Mhm.
bedside and just think
Mhm.
of how the body works. Just think of those symptoms and don't be afraid to think outside of the box. I mean, there's so many new programs that have started around the country at elite institutions that functional medicine is a topic. You can be an MD and do this type of work, and you don't have to be a family practice doc. You can be in any specialty. I work with OBGYN and GI doctors. I have a neurosurgeon that's also on the board of ILADS with me. So it's just people who know that there is something more under the surface when a person is chronically ill. So just think about expanding your horizon. Look at things like the Institute of Functional Medicine, where I first kind of learned, years ago, 11, 12 years ago, about just functional medicine. Be open and try your best. Don't just get in this one box, because even that one box and that one specialty you're going into, I can guarantee you're going to see patients who have some other conditions that are underlying root causes. And evidence-based, sure. But who's publishing all the evidence? So ask yourself that.
No, that's fantastic. I mean, one of the main reasons we started this podcast was we wanted to hear people talk about their illness. You can get doctors speak anywhere, but nobody wants to hear that. They want to hear somebody's story. And it sounds like with you and what you do, you've got the medical behind you. I mean, obviously that's what you have to do, but you've got that bedside manner where you're listening to people, trying to find out, like you say, the root cause and do the investigating. And that's not what's taught in med school. It's the science part of it. And you're doing the bedside manner part, which is amazing.
Yeah, it's hard. It's not easy. And sometimes it goes down rabbit holes. Sometimes my kids come in like, turn off that computer. Sometimes I get so excited when I learn something new. And that's most doctors in this field, that you're like, yes, let's apply this now. I have like 400 pages of notes of things I've learned through the years. And then one thing will happen. You're like, oh, yeah, I was using that 5 years ago. I forgot about that. So it's just one of those things where you just have to try your best, as well as and be an open doctor
Right.
as well. Because so many patients get called anxious and depressed. That's the easiest diagnosis you can make. Oh, you have anxiety. Get out of here. And it's a lot of times it's not all in their head. Majority of times it's not all in their
Well,
head.
it's good that you're taking the time to really listen and understand. And again, like you say, a lot of times doctors will just want to see the next patient. So boom, 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 here's your diagnosis, bye. And that's not the way to treat people. So and I'm sure your patients who really appreciate the time and the care that you give them.
Right.
Now that we have a bit of a background information, it's time to talk about our initiative. To better serve our listening audience, we are an affiliate of a major medical supplier here in the United States. You will find affiliate links on our website, PodcastDX. They aim to tailor specific medical supplies and equipment based on your diagnosis to make it less stressful than looking through an entire catalog for what you might want or need. We are open to your suggestions and will adjust our offerings based on what you, our listeners, find helpful. But now let's return to the show.
Thanks, Ron. Dr. Cornish, how do you maintain a good work-life balance?
That is a good question. After listening to you talk
Right.
with everything you do.
It's an awful question. Don't put me on the spot.
Come on.
Who thought of
Self-care.
that question? Every time I do an interview and I get that question, I tremble because I'm like, what do you think? Like, I'm a mom of triplets and I work
Do you
full
sleep?
time. But the one thing we do a lot is we travel, and it might be quarterly travel, but I know that's going to give me time, especially if we go out to the country or Caribbean, to just unwind. I wish I could be honest and say I do yoga every day, but that doesn't happen. I just found that traveling and then just taking and turning that computer off and being with my kids. I mean, granted, that's a lot of work as well, but it does give me balance. Family and my faith, they balance me out. And that might be the only thing I have time to do. But, so many other people, when they get this question, they're doctors, I'm so jealous. I'm like, oh man, how do they do all that? But I just try my best. And a lot of times, honestly, I fail. But it's one day at a time. You got to find that way to decompress and take your time and, do what you need to do for your own brain health. Because if you're not good to yourself, how am I going to help other people? So
Right.
I, do integrate those methods as
So,
well throughout
good.
my.
Lita and I met in graduate school. We're both recreation therapists by trade. So our emphasis is on increasing self-esteem in people. And one of the things, and I stress this with my students all the time, and the people that I serve, is you got to have an outlet. Everybody has things they have to do in their daily life, and you are quite busy, obviously, in yours. But everybody needs an outlet, something that they enjoy in order to rejuvenate. Because if you're not rejuvenated, it's really hard to give 100% of what you're doing.
Right. Somebody was telling me, somebody was telling everybody on TikTok recently, you have to fill your own cup first. And I'm like, I don't get it. And he said, it's kind of like when you're on an airplane. If the airplane's going to go down, you have to put your mask on first before you put the mask on your child. And even though you think that that's the wrong way, you always want to put your kids first. You do. You have to do self-care. You have to take care of you in order to be well enough to take care of everybody else.
And that's absolutely right. And some weeks, I tell my patients that every day. And sometimes it's like, do as I say, not as I do.
Right.
But I did make, a conscious decision recently. I'll be 45 in 2 months. And I'm like, 50's around the corner. I got to, take some time out just for me. And every day I'm getting better at it.
Good.
And it prevents me from getting burned out.
Yep.
And I also have learned to say the word no.
It's tough though, isn't it?
And that is key to my self-care, is knowing what you can do and placing those limits when you can't.
Good.
Yeah.
Good for you. I'm very happy to hear that. Well, Dr. Cornish, thank you very much for joining our show today. How can listeners learn more about you and the Amen Clinics? Any social media?
Oh, thank you. So you can go to our website. It's www.amenclinics.com. I also have Instagram, and it's at dr.ebonycornish. And TikTok is at Dr. Ebony Cornish as well. So those are ways. I found social media only in the last 3 to 4 months, but I found it a way to just provide education to the masses. So my entire sites are not personal, because I'm not that into Instagram personally,
Right.
but it's all professional, little 60-second clips. And then if you go to, we have a YouTube channel for Amen Clinics, and you'll have a lot of short doctor videos and the like. So we're kind of everywhere, just spreading the word. And you can also learn more about the neurointensive inflammatory outpatient program on the Amen Clinic's website.
Okay.
There's a link for that and contact information for those that are interested. And if it's just interested in being a patient who really needs that help, who doesn't have that diagnosis, who's scared,
Right.
that's what I do.
Thank you.
Yes, thank you so much for your time this morning. We'll make sure that we add these links to our website.
And thank you for having me. This has been great.
Yeah, thanks for putting up with our little equipment failure in the beginning. But if you have any questions or comments related to today's show, you can contact us at PodcastDX@yahoo.com. We also have a website, PodcastDX.com. And we're on Facebook, Twitter, Pinterest, Instagram, and TikTok.
And if you have a moment to spare, please give us a review, a 5-star review, wherever you get your podcast. And as always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking it because of something that you have heard on this podcast.
Till next week.